My name is Jeffrey Kutcher. I'm a sports neurologist. I'm the executive director of the Sports Neurology Clinic. My education and training started with my University of Michigan undergraduate degree. I then went on to work for 5 years as a consultant in epidemiology in Washington, D.C. I then went to medical school at Tulane University in New Orleans, came back to Michigan for my residency in neurology and a fellowship in stroke. I have been the neurologist for the United States ski and snowboard team for the past 4 years, and was the neurologist for the U.S. Olympic team at Sochi in the Winter Olympics in 2014. I am the director of the National Basketball Association Concussion Program. I am the neurologist for the National Hockey League Players Association, and I'm a consultant for the National Football League Players Association as well. And I do work with the NCAA and conferences and schools, all with the idea of providing the safest and best environment for my patients to play sports. So I'm a sports neurologist, and what that means is taking care of athletes of all types, of all ages, and really any neurological condition in an athlete. The definition of athlete for us is more than just people who play sports. It's dancers and musicians and anybody who is really trying to get the most out of a physical activity. So at the Sports Neurology Clinic, our patients will span the spectrum of sort of young youth athletes who may have had their first concussion or second or third, but also any patient who's concerned about playing sports and the neurological problems that can come from playing sports. So we will see, like I said, young youth athletes, junior high, high school, college athletes, professional athletes, former athletes, really the entire lifespan of the athlete we take care of in our clinic, and the entire spectrum of neurological conditions. Now, being what sports are, and the fact that they are something that have a risk of contact, obviously brain health, post-traumatic brain injury, brain health is a very large part of what we do. What a patient can expect from seeing myself or one of our other providers in the Sports Neurology Clinic, whether it's here in Southeast Michigan or anywhere in the country, is first and foremost a complete and comprehensive neurological evaluation. We are individuals who are trained and have experience in being able to examine the brain of a living person in a way that is comprehensive. And that is something that you can't just throw a tool at, you can't just have one simple approach to these problems. You have to come at it from a larger perspective. And so our patients will get that. They will be seen by individuals who get not only one aspect of the problem, but the entire picture. One of the things that's very common in our clinic is we see patients who have been told they should stop playing the sport because of the number of concussions they've had, the number of injuries they've had, and they may be having some symptoms going along with that. What is really unfortunate is those recommendations are most often made without really considering the whole picture. There's a lack of critical thought, there's a lack of expertise that goes into those decisions, because not all symptoms people are having in that scenario come from the brain trauma itself. Oftentimes the symptoms come from many different variables, and we tease apart all of that. And our understanding, and being a former athlete myself, but really taking care of my patients over the years, I know that playing sports is more than just a hobby. It's more than just something that people do to pass the time or stay out of trouble or have some exercise. And not for everybody, but for a large segment of athletes, it really defines who they are. It becomes who they are. And they grow up and they develop. Their brain becomes wired while they're playing sports. And so to take that away from them is a huge impact, a very substantial impact on their life. And so we shouldn't do that without really having a comprehensive approach to the problem and understanding that people can have symptoms for different reasons. And at the end of the day, patients who come to us with problems with sleep and headache and even things like dizziness and problems thinking and all that, quite often are not from their brain trauma. They're from not playing sports, and they're from the sleep problems that come along with that, and the anxiety issues, and the attention problems that come along with not being able to sleep, and they're all kind of wrapped up together. And tease those things out and provide each patient with a road to get back to the quality of life they want, which may or may not include sports, is what we're all about. So the Core Institute and the Sports Neurology Clinic are a fantastic partnership because the Core Institute provides a level of experience in taking care of populations, in providing healthcare, specific healthcare, quality healthcare to large groups, and doing it in an efficient manner, which is one aspect of what we need to do with the Sports Neurology Clinic, to be able to provide the same type of care, the same approach to multiple groups and multiple locations is sort of the natural fit between the two. You know, in the neurology world, in the sports neurology world specifically, you know, we have issues that are very, very similar to the sports orthopedic world, which is trying to keep our patients active and healthy and engaged in sports. And so there's a natural partnership there. The most rewarding thing for me about being a physician is being able to improve the quality of life of my patients. And again, that sometimes involves treating a very specific injury and problem, and sometimes it involves being able to develop a plan to get them back to doing what they want to do. And at the end of the day, whether it's a young athlete, a 10-year-old, 12-year-old kid, or somebody who's playing in high school or college, or a former athlete later in life, if you're able to improve their quality of life, that's a reward like no other.